Hello, this is Dr. Stanley Lang, and welcome to this presentation. This is a continuation in a series of videos that I'm doing on the subject of whole person health and focusing on either physical, emotional, spiritual health on whatever the day might be. And today I'm going to revisit the topic of reversing diabetes type 2. So this is something that I've spoken on a lot because it's such a big problem. And estimates of people who are diabetic or pre-diabetic are exceeding now 50% of our population, which is a tragedy, but also an emergency. And one of the things I want to point out today is that when you have a new onset of diagnosis, a new diagnosis of diabetes type 2, and you haven't been diabetic very long, at least as far as you know, that's the best time to strike, because that's the best time you have to be able to completely reverse the abnormal chemistry that's developed. Now, you got to that place over many, many, many years, maybe even decades, but when you turned the corner and became diabetic, that's still the best time to strike. Now, people who have been diabetic for many years already still have a chance of reversing their diabetes. But at the very least, they have a good chance of improving their control dramatically and decreasing their medicines if they can't completely reverse it. But in my experience, most people who are type 2 diabetics who haven't been in that situation for decades can reverse their diabetes if they're willing to follow the program. So this particular patient that I saw just yesterday was diagnosed in January, and she came into the hospital basically in a crisis. She had a bad infection going on, inflammation going on in her abdomen, and they just discovered that she was diabetic in the process. That wasn't why she came to the hospital, but in the process of doing the various testing, she was discovered to be diabetic, and she was a diabetic in really bad control. Her A1C was over 10, and that usually translates to a really high blood sugar for people that aren't familiar with that number, but an A1C of 10 is really bad news. And when I saw her in the office, she very much did not want to be on the medicine that she was taking. She was already on insulin. They put her on insulin in the hospital, and she wanted to get off the insulin. She wanted to not have to take other medicine, and so I mapped out my usual program. It's a simple program. It's a program anybody can follow if they're motivated. And fortunately, it's a program that helps a lot of other problems at the same time, which I won't go into right now. And when I saw her back yesterday, her A1C had dropped to 6.3. Now, in our lab, that's the upper limits of normal. In other words, she had literally normalized her average blood sugar in 3 months from the high above 10 level to 6.3. Now, if a drug had done that, you would be seeing advertisements on television like this is the most miraculous drug ever invented. It's going to save millions of lives, and somebody would probably win a Nobel Prize. Now, all she did was followed some simple strategies that God built into your system. You're already pre-wired. You don't need to be rewired. You're already pre-wired for your body to fix itself if you follow the right simple principles and take the extra nutrients that your body needs, and most people are severely deficient in by the time they get to this state. And these nutrients fall into the category of macronutrients, which means the good fats, the important fats, the people that are deficient in, especially the essential fats, but also many, many different micronutrients. And for the person who's willing to change their lifestyle in this way, and just all she did is added in a modest exercise program, which I did challenge her to something a little bit more aggressive on this follow-up visit because she was doing so much better. So the take-home message is this: if you have type 2 diabetes, or you know somebody that does, there's a good chance that they can reverse their diabetes. Not just not a maybe slight chance. It's a good chance that they can reverse it. And if they can't reverse it, they can dramatically decrease the medication that they need to take. Sometimes there are some physical limitations for following the whole program, and I understand that. But even if all you can do is follow the dietary strategies of this particular low glycemic eating, you're going to be successful. And this particular approach I developed because I wanted to have something that people could eat the rest of their life. I'm not interested in a short-term strategy that gets you a short-term goal and then you revert to some other second phase diet. This is a strategy that you start with and you end with. And it can keep you very healthy for as long as you choose to be on this approach. So I offer these thoughts because I want to give you hope that diabetes isn't as bad as it seems if you're willing to pay the price to change your lifestyle. The big problem is that people try to be in two different camps at the same time. And this is partly because the dietary strategies taught by the American Diabetes Association does cut corners. It compromises and it allows too many high glycemic carbs in the diet to allow people to completely reverse their diabetes. They'll never get there without following a different strategy. Their control may improve, but they will not reverse. So my encouragement to you is that you can have hope that if you're willing to pay the price, and it's not a big price, if you're willing to pay the price, you can probably reverse your diabetes, and if not, at least dramatically improve its control. And again, we're talking about type 2 diabetes. This is insulin-resistant diabetes. It's not type 1 where you're deficient in diabetes. So the other aspects of this person's strategy is that she has a deep spiritual life, and she uses this to her advantage because having a deep spiritual life and contact with God on a regular basis dramatically decreases stress. And if you are in high stress, you're not going to be able to reverse your diabetes. You have to be able to limit the effects of stress on your life, or the cortisol levels that are pushed out by the high stress environment will keep you stuck in much higher levels of insulin resistance, and you won't be able to reverse the diabetes. So you need preferably multiple ways to mitigate the effects of stress. That's one of the big cornerstones of the program that I've developed. But the foundation is you got to eat low glycemic. That's the starting point. And so I encourage you to explore that. I wish you well, God bless, and have a great day.